My name is Kevin Intrego Favara. My topic is NGAL, expression and potential fusion in human pocket epithelium. Definition. Neutropil gelatinous associated lipocalin and member of the lipocalin family of small secreted proteins, was originally identified as a protein stored in specific granules of human neutrophils.
Kidneys filter 1,500 liters of blood every day. 20% of the blood pumped by the heart flows straight to the kidneys. The actual filtration of the blood and production of urine is performed by the nephrons, the small functional units of the kidney. They fine-tune the composition of blood and remove waste from the body. Basic filtration of the blood is performed in the glomeruli, which are located in the renal cortex. The hydrostatic pressure across the glomerular filter pushes small molecules into the tubule, but keep large molecules within the blood. During one day, 180 liters of primary filtrate are produced by this process. To prevent the body from losing vital blood constituents, the tubules reabsorb 99% of the filtrate back into the blood. The tubule is not a one-way street. By means of secretion, it removes additional molecules from the blood that have escaped filtration by the glomerulus. Thereby about 1 to 2 liters of urine are produced and excreted via the ureters, bladder, and urethra. During acute kidney injury, AKI, the nephrons are damaged. To detect this, one can examine kidney structure and function. Creatinine is the classical marker used to analyze kidney function. Creatinine is continuously produced in muscles, filtered almost completely by the glomerulus, and passes the tubule without being reabsorbed. The balance between creatinine production and glomerular filtration determines the typical serum creatinine concentration of an individual. A major disadvantage of measuring creatinine is that half of the million or so nephrons may be damaged before increases in serum creatinine concentration can even be detected. Moreover, these increases do not occur before 24 to 48 hours have passed following the initial injury, because creatinine has to accumulate in the blood. A new biomarker assay now permits kidney injury to be detected before it has a measurable effect on kidney function, also called GFR. As soon as nephrons are damaged, they release the NGAL biomarker. As early as 2 hours after the onset of AKI, NGAL levels in the urine or serum are markedly increased. NGAL stands for neutrophil, gelatinase, associated, lipocalin. This nomenclature originates from early studies that isolated NGAL from neutrophils. In the absence of kidney injury, tiny amounts of NGAL are produced in various organs. Although it is filtered as a small molecule in the glomerulus, it is reabsorbed into the blood in the proximal tubule. In the event of acute kidney injury, the distal nephron releases large amounts of NGAL and excretes it into blood and urine. In addition, the NGAL reabsorption machinery is damaged, which causes the levels of urinary NGAL to increase even further. In a case of AKI, high concentrations of NGAL can thus be detected in only a few drops of urine. During surgery, ischemia is a frequent cause of AKI. Most of the damage to the nephron is caused by inflammatory processes during the course of reperfusion. Other frequent causes are sepsis and cardiogenic shock, for example in the event of a myocardial infarction. Another possible cause is hypovolemia, for example due to bleeding in the gastrointestinal tract. Also, several therapeutic and diagnostic agents that are applied in the hospital may cause AKI, for example antibiotics or contrast media. During heart surgery, the cardiopulmonary bypass pump maintains only a minimal blood pressure.
Application in nursing. The tissues release of NGL can be induced by inflammatory process in the tubulus RNA increase the expression of the NGAL and 12 hours after the nauseous stimulus.
Good morning, ladies and gentlemen. I wanted to thank the Congress organizers for inviting me to share these results with you today. And the topic on my talk is neutrophil gelatinase associated lipocalin, or NGAL, otherwise known as lipocalin-2. It regulates the onset of serum autoantibodies in tristan-induced lupus. So just a few words of introduction on NGAL. NGAL is a member of the lipocalin superfamily. The lipocalins are very important in iron transport, and this is quite ubiquitously expressed. Originally it was found in gelatinase and neutrophils, but really found widely in hepatocytes, alveolar epithelial cells, and resident kidney cells, including mesangial cells and especially podocytes. It is found that NGAL is a very sensitive responder to a variety of insults, ischemic inflammatory conditions, including metabolic diseases, organ transplantation, and neoplastic diseases as well. The relevance to lupus and to nephritis is that in parallel, in the last couple of years, there's really been a tremendous expansion in the use of NGAL as a biomarker of both acute and chronic diseases, acute and chronic kidney diseases, and I will show you this is also relevant to our lupus patients themselves. From the point of view of pathogenesis and importance in inflammatory pathways, NGAL is known to be involved in innate immune responses, and in NGAL deficient mice, these mice display a broad variety of apoptotic defects which might be relevant to understanding the findings that I'll share with you in a few minutes. In investigating the mechanisms of pathogenesis of anti-DNA antibodies, we found that one of those stimuli that can upregulate NGAL is pathogenic anti-DNA antibodies, while non-pathogenic anti-DNA antibodies did not upregulate NGAL in renomesangial cells. And furthermore, that this is not just a marker of disease, but is also directly involved in pathogenesis. We found that it's a marker of human lupus nephritis, and this is actually work done by an Argentinian physician who was a postdoc in my lab, Milena Petashny, who showed some years ago that lupus patients with nephritis have a higher titer of urinary NGAL than patients without nephritis and compared to normal controls. And NGAL concentrations, urinary NGAL concentrations, showed a linear and significant correlations with the renal SLEDAI score as an indicator of severity of nephritis. Moving to mice, we wanted to find out if we wanted to measure whether NGAL is also elevated in the serum of lupus mice. We looked at BLAC6, which is the negative control. NZBW, shown in green, is much significantly higher than B6. Then the next couple to compare is MRL+, which has an autoimmune tendency, but is basically the control background. And as you see, MRL-LPR lupus mice have greatly increased titers of NGAL, both in serum and in the urine as well. Moving to an induced model, we looked at nephrotoxic seronephritis. Nephrotoxic seronephritis is a commonly used model for antibody-induced nephritis. It's induced by passive transfer of preformed anti-glomerular antibodies into non-autoimmune mice, and these mice within 7 to 10 days go on to develop a rapidly progressive crescentic and necrotizing glomerulonephritis.
Pros and cons. Published studies have shown how the age factor modifies the performance of NGAL as a biomarker of ACAM8, with better predictive capacity in children compared to adults, which is low.
We wanted to find out if we wanted to measure whether NGAL is also elevated in the serum of lupus mice. We looked at BLAC6, which is the negative control. NZBW, shown in green, is much significantly higher than B6. Then the next couple to compare is MRL+, which has an autoimmune tendency, but is basically the control background. And as you see, MRL-LPR lupus mice have greatly increased titers of NGAL, both in serum and in the urine as well. Moving to an induced model, we looked at nephrotoxic seronephritis. Nephrotoxic seronephritis is a commonly used model for antibody-induced nephritis. It's induced by passive transfer of preformed anti-glomerular antibodies into non-autoimmune mice, and these mice within 7 to 10 days go on to develop a rapidly progressive, crescentic, and necrotizing glomerular nephritis, very similar to what is seen in lupus. There are 3 groups. You see here NTS challenge mice that received the nephrotoxic serum, that received normal rabbit serum and PBS. You see that the nephrotoxic serum challenge mice have significantly increased serum NGAL and even more dramatically of urine NGAL. So clearly it's a biomarker for the activity of nephritis. But is it just there? Is it just a innocent bystander, or is it directly contributing to the pathogenesis? We then induced our nephrotoxic seronephritis in NGAL sufficient mice or NGAL knockout mice. And as you see on the left, NGAL knockout mice were very significantly protected from nephritis. And as you see on the right, when we actually looked at renal histology, not only were there significant differences in proteinuria, but NGAL knockout mice had significantly improved or attenuated renal histopathology. Their nephritis score was less, they had less hypercellularity, immune deposits, etc. So at least from an effector stage, once you transfer pathogenic antibodies into mice, NGAL deficiency is protective, suggesting that in nephritis, blocking NGAL might be beneficial. And then we wanted to continue to assess the effect of NGAL, or the role of NGAL in generating autoantibodies, not only in the response in the kidney, but will it also affect antibody generation? And we used the Pristane-induced model of lupus, which is a widely used murine model of lupus, and its advantage, one of the major advantages, is that it's inducible in black 6 mice, which is the background in which we had the NGAL knockout. So we injected Pristane into B6 mice, or the NGAL deficient mice, and followed the course of disease. We looked 4 months after Pristane injection. Control groups of each genotype, so B6 or the B6 knockout, were injected intraperitoneally with PBS. And our hypothesis was that, similar to what we found for nephritis, we would also see an effect on antibody generation as well. And as hypotheses go, we were surprised. Just briefly about Pristane-induced lupus. It's a reproducible and robust model popularized by Wes Reeves, in which these mice develop antibodies to DNA, single-strand DNA, chromatin, SM, RNP, and ribosomal P, which peaks at about 6 months following a single injection of Pristane intraperitoneally. These mice have a very strong local inflammatory response with lipogranulomas in the peritoneum. And they also
use appeared in Ecuador. NGAL has important interaction with other receptor and ligand, such as factor growth derivative for hepatotoxicity, henalinase B, and extracellular protein kinase.
NGAL is a very small secreted protein, secreted from several tissues, we know that, but what I'll focus on here is the NGAL that we know comes from primarily from the kidneys. It's very protease resistant, secretion in high levels into blood and urine upon injury of the kidney. Very fast after the injury of the kidney, this comes out in blood and in urine. Is it the same? Well, is it the same to measure? No. We know that. If you have a patient coming into the ICU, into the hospital after a burn, an accident, and you measure NGAL in the urine, it'll be a mix of whatever urine has been collected in the bladder during the last 4, 6, 8 hours. So it'll be an average. On the other hand, if you take a blood sample, it'll be the NGAL in the blood at that moment. So you can measure both, and you can use the same NGAL to measure both, but you might not get the same result. Maybe because of the way of testing, the method that you use to take the sample. It is slightly increased expression in inflammation, infection, and certain cancers. However, it stays below the cutoff levels that we have already been told about that we use for measuring NGAL and to detect and to diagnose. So we can
Conclusion. Is the clear that NGAL represent a new predictive biomarker for ACAN-A, but nevertheless, NGAL appears to be more sensitive and specific in more homogeneous population of the patients with temporally predictable forms of ACAN.
you do the diagnosis. This is a study where NGAL for early diagnosis of AKI in a defined setting. So this for urinary NGAL and serum creatinine, it was compared. And what we see here is that AKI is defined as 50% increase in serum creatinine from baseline. No AKI, it's flat. AKI, we see the race. If we did the same with NGAL, we would see this one. This is not a one patient. It's not NGAL from one patient, right? It's an average of all the patients that incurred AKI. But you see it within the first 1 or 2 hours after the procedure. Just to exemplify how fast NGAL will show what you're looking after instead of using serum creatinine. This is another one, NGAL across all settings. It was a study, evaluation of NGAL in subclinical AKI, means before creatinine rise, because that's the definition of AKI. It was 13 international medical organizations collaborating, so it's quite robust. It's again Michael Hase, which also was on the previous presentation, collecting all these data. And the objective was to prove that NGAL levels identify patients with subclinical, means undetected, AKI, before diagnostic changes in serum creatinine. And what did they see? So here we use NGAL is positive, NGAL is high, serum creatinine is not. So these are the parameters we compare to NGAL is not high and neither is serum creatinine. Okay? It's 16 times more likely to need dialysis if you are in this quadrant. Okay? You are 3 times more likely to die during hospitalization. And they spend 3 extra days in intensive care, 8 extra days in hospital. This part of the cohort is more than 25% of the whole study. So they will go undetected.